Madam Deputy Speaker, I won't focus on assisted dying, assisted suicide this evening, because as the member for Wimbledon said in a very good opening speech, we are all united in this place in our desire to see improvements in the palliative care system. But I do feel compelled to make this simple point of fact, which is that in studies research shows that in jurisdictions and countries around the world which have introduced an assisted dying and assisted suicide law, the investment and the quality of palliative care declines relative to those countries which haven't got an assisted dying, assisted suicide law, and that's for reasons which are fairly comprehensible. It is a fact. So I surely, Madam Deputy Speaker, I implore the House we should fix our palliative care system before we consider opening up a law on assisted dying. Now, the United Kingdom is, of course, the birthplace of the hospice movement, and we have some of the best palliative care services and specialists in the world here. But as we've heard this evening, the fact is that our system simply isn't working. We have demand for palliative care, for hospice services, on a scale that was never anticipated in the post-war years when the NHS was developed. And of course, the challenges of growing demand have been sadly exacerbated by decisions that the government has made, as we've heard this evening. And I'll quickly mention the two.
On that point,
happy to give way.
I went to St Barnabas Hospice in Lincoln on Friday, our local hospice. They do wonderful work. I talked to the CEO. He's literally tearing his hair out because of this NI increase, he's losing £300,000 a year. He pays his nurses less, he has to, than the local hospital. He's literally funding the NHS and cutting his own service in the hospice. I beg the government to sink again on this NI increase on hospices.
My right honourable friend makes absolutely the right point, and it's one echoed by the experience of hospices across the country. And the Prospect House, which is on the edge of Swindon in my constituency, in East Wiltshire, only receives 23% of its funding from the taxpayer. They faced a significant deficit this year. They took immense pains and steps to meet this funding shortfall. A huge response from a public fundraising appeal raised them over £170,000 from the local community. That was before the budget. The effect of the national insurance increase alone on Prospect House is £170,000. So the entire generosity of the public has been swiped away by the Chancellor and put Prospect House back exactly where it was. A similar experience by Julia's House in Devizes, a children's hospice, the most wonderful place, the most moving place I've visited in my time as an MP. They only get 8% of their budget from the taxpayer, and their deficit has gone up from 900,000 before the budget to 1.1 million now. So we desperately need a comprehensive review of palliative care, and I want to pay tribute to the Honourable Lady, the member for York Central, and also the noble Lady Baroness Finlay in the other place, who are leading a review of palliative care, with a review to coming forward very soon with recommendations for the government on how to improve the system. And indeed, thanks to Lady Finlay's amendment to the Health and Social Care Act that the last government passed, ICBs are now required to commission palliative care as part of their obligations. Unfortunately, no money was attached to that amendment to the bill. And as we've heard tonight, the way that different ICBs commission care is not good enough. For instance, I regret that the local ICB in our area won't commission Julia's House, the children's hospice I mentioned. So we do need a better commissioning model. And I want to just take issue with the point made by the Honourable Lady for Birmingham Erdington, who suggested that the ICBs can't find money within their budgets to do this. I actually think that if the ICBs did their job properly, commissioning services locally, they should be able to move budgets around, because the fact is that if you invest properly in palliative care, you save money elsewhere in the NHS. This is a crucial point. You reduce expensive bed stays in hospital, and you reduce the demand on ambulances and other services. So it should be possible, I think, to improve palliative care within the envelope that ICBs currently have. We do not want a system of enforced uniformity, not a great new national bureaucracy. I'm concerned that some members have been suggesting we sort of nationalise the system. I don't think that's right. We need to ensure that the ICBs can do the job that they need to, and that hospices themselves can innovate in the way that they want to. Thank you.